Hi, my name is Hayden, and my friend Kyle is recording, and my friend Chris is here also to watch. Experiencing rapid mood swings, dangerous behavior, and having abandonment issues are most common symptoms of borderline personality disorder. I have seen firsthand at how much of a toll this disorder can have on a person. Back in high school, one of my closest friends was diagnosed with borderline. Mental health is also important now more than ever before. So my goal for today is to explain what borderline is, some of the most common symptoms, how to diagnose it, and what treatments are available for those who need it. But before we dive deep into the disorder, let's talk about what it is. Borderline is considered a personality disorder. In the 2013 Diagnostic and Statistical Manual of Mental Disorders, the APA states that a personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual culture, is persuasive, onset in adolescence, stable over time, and leads to distress or impairment. In the Diagnostic and Statistical Manual, published in 2013, the APA also states that borderline is a pattern of instability in interpersonal relationships, self-image and effects, and impulsivity. So overall, people with borderline tend to view things in extremes, whether it's a good thing or a bad thing. Now that we know what it is, let's discuss some of the most common symptoms. According to the National Institute of Mental Health in 2017, some of the symptoms can include abandonment, unstable relationships, self-harm, mood swings, and impulsivity. Now, borderline is often hard to diagnose because many of these symptoms go along with other mental illnesses. For example, self-harm can relate to depression, while mood swings and impulsivity can relate to bipolar disorder. So it is important to understand all the different types of symptoms so we can get the right diagnosis. In order to diagnose for borderline, you need to experience 5 of those symptoms and have them begin in early adulthood or adolescence. Now, people with borderline disorder often experience a fear of abandonment. So they may experience irrational anger when there's a change in plans, and then they tend to believe that they are bad. Another common symptom is having unstable relationships. They may idolize their caregivers or lovers, but then resent and push them away. They may also claim that they are not there enough. Another common symptom is having impulsive and dangerous behavior. Many will tend to spend money irresponsible, have unsafe sex, binge eat, and often drive recklessly. Now, all of these symptoms may sound scary, but there is no need to be scared. There are treatments available to help treat this disorder. The treatment is limited to therapy, specifically mentalization-based treatment. Anthony Bateman and Peter Fonagy of Oxford University stated in 2004 that the general aim of mentalization-based treatment is to help the patient to establish a more robust sense of self so that they can develop a more secure relationships in their lifetime. In the 2004 report on borderline personality disorder, Bateman also states that the main aims of mentalization-based treatment are identification and appropriate expression of affect, stable internal representations, a sense of self, and a capacity to form more secure relationships. It is also important to use evidence-based treatments because many patients experience less severe symptoms as well as an overall improved quality of life. Now, borderline personality disorder is often misunderstood, so it's important to understand all of its components. And like I said in my introduction, mental health is more important now more than ever before. So the more we know about mental illness, the more we can help those who tend to struggle. Now, these symptoms may sound scary, like I said, but there is no need to be afraid of people with borderline personality disorder. They are normal people just like you and me.